Welcome to the Life-After-Whipple project. I'm Greg Adams, a pancreatic cancer survivor and the current team leader. One of the things I've learned on my pancreatic cancer journey is that stress plays a significant role in your journey's outcome. When I found out that this was a topic of interest for Dr. Howard Crawford, the scientific director of the Henry Ford Pancreatic Cancer Center, I asked if he would discuss this topic with our members here. Tonight, Dr. Crawford is going to share what he has learned about the role stress plays in both disease development and progression. Howard, I'm going to let you take it from here.
Okay, thank you, Greg. And I have to say, I appreciate the idea of what we've learned, but I really want to emphasize that it's what the field has learned. So, yes, this is something I'm very interested in, but I'm also interested in communicating with everyone that the idea that stress can play a gigantic role in the progression of pancreatic cancer and probably many cancers. So it's something a message that maybe should get across to many cancer survivors and their families. Particularly, I have to say, when we're talking about stress, I really want to emphasize the role of the family. So when it comes to pancreatic cancer, there's a unique history or association of pancreatic cancer with the nervous system. And what I mean by that is that when you look at the pancreas, it is a highly innervated organ. That is to say that there are a lot of nerves, and I mean sensory nerves, in the pancreas. And why is this important? This is taken from a paper that's talking specifically about a process called perineural invasion. And what that means is the pancreatic cancer cells take advantage of the fact that there's so many nerves within the pancreas to use that as a pathway to metastasize and spread to other organs in the body. And we've known this forever. It's probably the most common form of pancreatic cancer metastasis is this perineural invasion, where the cancer cells have an affinity for the nerves. And there's many, many molecular reasons for this. I'm not going to go over this whole slide, but just to look at this part of it, the idea that there are ways that the cancer cells and the nerve cells communicate with each other. That is to say that they have a tropism. They are attracted to nerves. They do interact with nerves, and that allows them to migrate towards the nerves and then find the nerve bundles and then move up them and to go into other organs. But the main point about this is that we've known this for decades, that this is a way that pancreatic cancer spreads. But just the idea that there's so many nerves within the pancreas, and again, I want to point out sensory neurons, that is to say the ones that would be the same that you would get with touch. This is a major issue with the pain that pancreatic cancer patients feel when they have pancreatic cancer, even before they're diagnosed with pancreatic cancer. Some of the gut pain that's associated with that is profound and can be profound. But the idea that there are all these neurons within the pancreas leads to all kinds of questions that have to do with what we're here to talk about today, which is the idea of stress. So don't worry about the title of this paper. It's just to remind me what to talk about for this particular presentation. This is a scientific study done by Tim Wong at Columbia University. And what he did in this experiment was he actually took a mouse model of pancreatic cancer. Like the one thing that we have in pancreatic cancer is we have tremendously accurate animal models. And he took an animal model that normally would not progress. It would start to form the early stages of pancreatic cancer, but would not actually progress all the way to pancreatic cancer, at least not very efficiently. And what he did was he took these mice and deliberately put non-pain, but stress on these mice by what they call isolation stress. So mice don't like to be alone. So they put isolation stress on these mice that would normally not actually form pancreatic cancer. But they had the precursors to pancreatic cancer. And when he stressed those mice out, they would progress very quickly to pancreatic cancer. So the idea that there was communication between the nervous system, the stress detecting system, and this slightly altered but not entirely cancerous tissue to promote cancer progression that this was a really important finding in the field. And he did all that you can tell maybe from the title. He found the molecules that are involved, the different way that they're communicating with each other. But the main message I wanted to convey for this audience is that stress is able to take something that may be more at risk for cancer and turn it into cancer. And associated with that study, I should say, I'm going to go forward. This is a quote that was written about the study, that there are studies that show that that patients that are on beta blockers, that is to relieve some of the stress that are associated with, I know many of you that have heart conditions know that beta blockers are actually blocking beta adrenergic receptors so that you don't have these stress responses. In fact, that patients that were on beta blockers, and I'll give you a little idea of how this works a bit, that they're they live 2/3 longer than the ones that were not taking these medications. Now, that sounds very impressive, and I want to be really careful about this. Looking deeper into these data, while this is true, it's the patients that were taking beta blockers before diagnosis and throughout after diagnosis that show this benefit. There are all kinds of stress factors that are associated. If they didn't have beta blockers before their diagnosis, there wasn't any obvious benefit. And if they didn't continue it, there was no obvious benefit. So it's really pre-diagnosis all the way through diagnosis that this benefit was shown. So another study that was done that really gives you a strong idea of the association with the nervous system and pancreatic cancer formation is here. You might actually recognize one of the authors of this paper, but the idea of this paper was that an animal that is designed to develop pancreatic cancer long prior to the formation of that cancer, that really the major drivers of the study, Andy Rem and Brian Davis, what they showed is that if they ablated the sensory neurons, and we'll talk about how they do that in a second, ablated the sensory neurons before cancer formed, that cancer was much less efficient in forming. And this is it's called a Kaplan-Meier curve. It's just really easy to describe that the sharper this goes down and the earlier it ends on this axis is that's the survival. So very poor survival of these mice, but when they've had their sensory neurons ablated, that they survive a much longer time. And the way they do this just is sort of a trivia question almost, is they're treating these mice with capsaicin. For those of you that don't recognize that word, the capsaicin is the active component of hot peppers. And if you give a young mouse and a young person a sufficient amount of capsaicin, the sensory neurons just sort of are overwhelmed and die. They can't handle that much, in a sense, heat. And so therefore they can ablate them. So when they ablate the nerves, the mice live a lot longer. So that's very complementary to the observation that happens in human patients, that the patients that are on beta blockers before and during and after their diagnosis, that they also live a lot longer. So that if there's essentially ablation of the neurons or a cessation of stress, that the patients or the mice, whether the patients be the mice or be the human, live longer. So I don't have any other slides to present, but I think that what I'd like to have is a discussion about this, because there's so much that's involved in the stress that's experienced by pancreatic cancer patients, that I always like to give this discussion, this message. Stress definitely has an effect on the progression of pancreatic cancer, because pancreatic cancer has sensory neurons that are innervating the tissue. And in fact, what part of that study I just showed, that idea that if cancers start to form in the pancreas, or even if pancreas becomes damaged or inflamed, that the sensory components, the dorsal root ganglia of the spinal cord, lights up and becomes inflamed itself. So there's a really strict communication between what's happening in the pancreas towards the the nervous system and what happens in the nervous system that affects the pancreas. So there's a really strict communication between these two organs, for lack of a better term. And so I always really, when I talk to patients, I try to communicate the science, because there is a scientific basis, but I also have a discussion with them about, particularly discussion with the patients, discussion with their family members, that it's really important that they alleviate stress in any way that they possibly can. I don't want to make any assumptions about how your own experience is, but I do know plenty of people. I find it particularly with when a pancreatic cancer patient and their parent, that the parent gets very stressed out about how their child has this terrible disease, and they kind of make it harder on the patient. They're like, oh my gosh, this is terrible. Blah, blah. That's the exact opposite reaction you need to have. You need to help. You need to figure out a way to relieve the stress on the person with the cancer. It's not your cancer. It's their cancer. It affects the relationship you have with them potentially. But the main thing is that they need to have whatever it takes to relieve their stress, to prolong their life in any way possible. So I had patients that dealt with me. I used to be in Florida at Mayo Clinic, and the pancreatic cancer patients there would say, hey, I like to play golf. I should stop playing golf because I need to stop having so much, physical activity. And I'm like, no, it's the exact opposite of what you should be doing. If you like to play golf, if that relieves your stress, that's what you need to do. And you need to surround yourself with people that will help you relieve your stress, whether it's a golf partner or whether it's eliminating your relationships with people who are stressing you out. That's really important, and we have biological bases for giving that advice. So again, it's still relatively new science about why the nervous system is affecting pancreatic cancer, but it seems pretty solid at the same time. So I was hoping. I've been traveling for a while, and I haven't had a lot of time to put together a huge slide deck. But what I was hoping was we would turn this relatively quickly into a discussion from you all to me. I can answer all kinds of questions accurately, I hope, so that we can have a real. I mean, this is the benefit of this group. I have to say, I've done this before, thanks to Greg. The real benefit for this group is how we talk to each other and how we communicate. So I'm going to leave this open for some questions and answers, and if I need to show any more pictures, I can certainly find
some. I am stunned. I had no idea that stress played such a role in the pancreas itself.
Yeah.
Yes.
With disease development and progression. My mind's just swimming, but one of the questions that popped up is the pancreas connected to the vagus nerve? I know.
Yes. In fact, what part of the study that was done at Columbia was that they severed the vagus nerve in the mice and showed that would prevent the promotion, the stress-induced promotion of the cancer. Yeah, so that was a major part of that study specifically.
So this is a possible intervention to prevent progression once it's discovered?
Yeah, that's the real question, and I don't think there's enough data out there to really suggest that, because once we discover pancreatic cancer, it's generally very highly progressed and potentially even already metastatic. I mean, most patients are diagnosed after they become metastatic. So how much benefit there will be at that point is a question. That's why I kind of wanted to bring up the point about the beta blockers. It's not the people that started taking beta blockers after they're diagnosed that had the benefit. It's the ones that were already on it for other reasons, I assume cardiac reasons, and then maintained it, because it's where it's most effective, where the at least in the animal models, it's most effective is in the early stages of the disease, which in the human patients, we do not usually detect the early stages of the disease.
All right. Well, one of the things rolling around in the back of my mind, you know, I have 11 ancestors that we know of that had adenocarcinoma of the pancreas.
Well,
Average life expectancy was 9 months. I'm the first one to make it past, but one of the questions that came up out at the University of Michigan genetics department, when they did my DNA and compared it to my sisters and my brothers, we don't have any markers for any form of any cancer currently known.
Mhm.
So their puzzle was, why did you get it? Not everybody in your family gets it. You know, it's 30 to 75% in each generation, but not everybody gets it.
Right.
Even though everyone that's been tested has a growth or multiple growths, cysts or tumors on their pancreas that are just sitting there. So stress is a possible factor, and I know there are a lot of different kinds of stress, and one of the patterns that I noticed in my family tree was ancestors and relatives that drank and smoked a lot be the ones that developed the disease. One of the reasons I have avoided those all my life, you know, so U of M wanted to know, okay, what in your environment, Greg, might have triggered this? And in my case, it was most likely Agent Orange.
Hmm.
Because that is a known substance for damaging the alpha cells in the pancreas and to weaken the structure. And then eventually, after 15 years of that, I became a type 2 diabetic when the beta cells finally crapped out. But it's, you know, anything that can cause stress on the body, whether it's chemical, psychological, physical, can have an
Yeah.
impact on
Absolutely. Anything that impacts the nervous system has this possibility, and so much of what we do. I mean, we experience the world more or less through our nervous system. So anything that is unpleasant from that can potentially cause stress. I want to point out also that you mentioned that, you know, the early stages of the disease, we all are walking around. I mean, I am not just not you. You mostly potentially are pancreatic cancer patients, but I am not currently. But I do have lesions on my pancreas, as you mentioned, and we know from, like, we look at organ donor pancreas, and that we're not diagnosed with any pancreatic disease, and we'll find the precursors to pancreatic cancer in essentially all of them. Whether they're 30 years old or whether they're 60 years old, we'll find them. So really the question is, how do we prevent those from progressing all the way to the cancer? And it's a really slow process that I would argue could be accelerated by the constant stress. The other thing is that we know that the African American community is at a 20% higher incidence of pancreatic cancer compared to non-African Americans, not just white, but white, Asian, Hispanic. And a lot of that is we don't know. We're all, Henry Ford in particular, we're looking into why that might be. But one of the obvious things is not just the stress of a lifestyle that maybe not as robust and more impoverished and more isolated, but also the idea of generational stress that may be involved in some of this. But I think that it's pretty clear that, and the message I always want to get across to people is that, you know, surround yourself with, you say, oh, we're going to surround, you have positive energy. People make fun of that. Oh, I want positive energy about it. But that's actually nothing to make fun of. Whether you get positive energy from religion, or whether you get positive energy just from relaxation, or from surrounding yourself with friends who support you and don't stress you out. You know, to me, that's what positive energy really is. And there's an association. You can find all kinds of studies that are, you know, defining it in different ways. But if you really look beneath the surface of, you know, whether it's prayer or whether it's, you know, other aspects, and they say, oh, there's a positive effect. I think it's not especially, you know, divine intervention so much as that this is what keeps my stress levels low, and this is how I feel support, and this is where I'm the most comfortable. And that's what's the common factors are with all those cases.
Could you do me a favor?
Sure.
Diane, Colleen, and Joe missed that first slide,
Mhm.
you know, where you showed the connection between the cancer and the nervous system. Could you
Yep.
review that one again?
Well, well, Howard, I feel really lucky. Can you hear me?
Yes, I can.
Okay. I feel really lucky. Not only did you, kind of give me some advice a couple months ago, I really appreciate it. But,
Hmm.
for several reasons. One, my cancer was discovered very early in stage one. So
Hmm.
2 years post discovery and 18 months after a Whipple. And but one of the things I did, and I didn't do it to lower my anxiety or anything. I did it because it just felt good, and that was I continued to work through treatment,
Hmm.
and then I also continued to play a lot of golf through treatment, and I also spent time with a lot of my old good friends
Hmm.
um, throughout, from earlier in my life, and I never thought about it as a way to reduce those techniques to reduce stress, but it really made a difference. And so
The
it's
combination of being diagnosed early, where it can have the most impact, and
yeah,
having a support system that you can turn to. I mean, sometimes, yeah, I understand work. I get it. I do. I work a lot, and I understand how stressful it is sometimes to not have that option. But I think people, gosh, I really don't want to project here, but people giving up on their lives because they got a cancer diagnosis, sometimes they don't have a choice. I understand that completely. There's just physical
yeah,
reasons they can't do it. But thinking that they have to is I I I feel it's a mistake, particularly if they find comfort in it. So yeah, you had a great combination there, early diagnosis plus a support system that you could identify, point to, golf, friends, etc. I think that has a huge impact. So I brought up the slide again. Can you see that?
yeah.
Okay, let me go through a bit. So so Diane and Colleen, so we were talking earlier about the pancreas is a highly innervated organ. So I wish I could. There's some beautiful pictures of this, but that I'm not sure it'd be you could totally appreciate. But if you look at this is the spinal cord, and there are dorsal root ganglia in the spinal cord that innervate various tissues, not just the pancreas, but pancreas amongst them. And there's lots of neurons that innervate the pancreas for all kinds of reasons. I mean, for also the reasons of insulin secretion, et cetera. So you like response to stress and digestion and things like that are also going to cause so insulin release, et cetera. So it's a highly innervated organ, and pancreatic cancers have been known for many decades to have a preference to metastasize. Not so much everyone talks about going through the blood system, the lymphatic system, and the blood system, but 100%, almost 100%, very very close to 100% of pancreatic cancers actually use these neurons
Mhm.
innervating the pancreas they grab hold of them and they move up them because the nerves and the pancreatic cancer cells are communicating with each other through various means, and then that attracts the tumor cells to the nerves. And once they find that nerve sheath, that they actually just travel along it to a distant organ. This is trying to show this. I don't know if I could really show. So here, for instance, these really long, spindly-like cells, that's the nerve that's coming through here, and these cells that are making this sort of circle system where you actually see a hollow space, those are the pancreatic cancer cells, and they are not they they are very closely associated. They are adhered to each other, and these tumors are probably, whichever direction, I don't know, are moving along this nerve bundle to metastasize to other organs. So besides the fact that the pancreas itself, the normal pancreas, highly innervated, tumor cells love to travel along the nervous system. They communicate with each other very actively. And just by virtue of that, if you think about they communicate actively in order to metastasize, well, they communicate actively before they start metastasizing too. So they are in constant communication with each other. And then if you can imagine, if you are stressed in any meaningful way, that would communicate some sort of signal to your cancer or to your cancer precursors or whatever, and push progression forward. And I was showing a little bit of data that earlier that showed in animal models that this is absolutely the case.
Wow.
Wow.
Yeah.
Is there any way to test for this to help with early diagnosis, Howard? Um,
Well, this happens 100% of the time. So the idea that you're testing for it, so it's an interesting question because the way the nervous system works in the spinal cord, there's different dorsal root ganglia that innervate each and every organ. So I mentioned earlier that if you cause damage to the pancreas or induce pancreatic cancer in the system, that it actually communicates and causes inflammation of the dorsal root ganglia. That it only causes it within that particular dorsal root ganglia that innervates the pancreas. So all the other ones are completely unaffected. And then some signaling molecules have been looked at, that suggest that signals are being received to the dorsal root ganglia. They all light up, but they light up specifically in the one that innervates the pancreas, not all the others that innervate other organs of the body. So is there an opportunity for early detection in that regard? I don't know. This is where my neurobiology kind of falls apart, as I'm not an expert there, and whether it's accessible or imageable in any meaningful way. I'm skeptical. I think that we would have implemented that by now, but I don't want to. With my lack of knowledge, I don't want to mislead. But yeah, for sure, if we could find a way to say, hey, the spinal cord is acting different in this particular patient in a way that we could use for imaging, that would be pretty impressive. But I don't know of anything at the moment.
I'm hoping artificial intelligence will help us, come up with better ways for early detection.
Mm-hmm.
It just seems like that's the key to save a lot of people's lives. I think is
Mhm.
really, we know that the earlier any cancer is detected, the earlier stage, the greater likelihood of people being able to live a longer life. So
Right. There are many studies going on throughout the world looking at historical and current scans of sometimes the entire body, but certainly of the pancreas or nearby where the pancreas gets caught in the side mirror or something. They actually see the pancreas. They can find changes within the pancreas that suggest that early pancreatic cancer is already formed, and a person has to look for really obvious changes. Whereas AI, if it's been trained appropriately, potentially can find something much more subtle that the human eye is not going to find. And there have been a few studies that have suggested that that's got a lot of promise.
great.
Mm. Mm.
Well, that's exciting. I think I work in the area of AI right now, and I really see some tremendous potential
Mm-hmm.
for helping us to predict, forecast disease at a
Yeah, I
very
think I think the data, this garbage in, garbage out. I'm sure you
yeah,
recognize that phrase.
yeah. Oh,
You
yeah.
Mhm.
know, we have to make sure that we have the right training data for all the AI so that it can be used. And the other thing is that early detection, if it's based on scans, is going to have to means everyone's getting a scan, and that's cost prohibitive.
Yeah.
So it's one of those things that maybe there's some symptoms that are completely non-specific, and then they get a scan for whatever reason, and then AI can take over at that point.
Yeah.
But that's the real issue with all kinds of screening is who gets screened. Who gets the actual test, and can we afford it if it's right or if it's wrong? Sorry, I'd say, well, how can we afford it if it's wrong one direction or the other? Misdiagnosed when they have it and they said no, or misdiagnosed because they don't have it and it says yes.
Yeah, it's interesting as I've talked to survivors, and I've talked to a number of people who had their pancreatic cancer discovered by accident.
Hmm.
Where they were being treated for something else, and they had a CT scan and it showed up, and so it's so ironic, I think, that
Yeah, and that's exactly right. I mean, so many people, if you get it diagnosed early, it's almost because you went in for a nosebleed. That's
Mhm.
just that's the way it works. But the funny thing, not funny, haha, but interesting thing about this is this interaction with the tumor cells and the nerves I mentioned earlier can be the source of pain in the patient, and it's going to be because it's very non-specific kind of pain. It's one of those pains that the physician has to believe. right? First of all, oh, that pain is so non-specific. Oh, that might be anything. You got a stomach ache or something, to dismiss it, versus like significant enough that they investigate. So it could actually be a relatively early diagnostic for pancreatic cancer. But the other side of this is that sometimes the pain that pancreatic cancer patients feel is because the tumor's actually grown so large that it's literally pushing against the spinal cord and causing pain in that direction. So this is a real subtle thing. These are cell to cell interactions that are causing very non-specific pain versus a real physical impingement on the spinal cord that says, something's not right on my back. So back pain, we talk about that as a symptom of pancreatic cancer. That's when the tumor is so large. But this non-specific pain, it can be caused by so many different things that it's not the pancreatic cancer is rare enough that's not the first thing that any physician will think of.
Any idea what the time frame you would estimate it to be from when this process starts until you have a tumor of a couple centimeters?
The mathematical models, whether I don't know how much I understand them, much less believe them, but the mathematical models could say between 20 and 30 years.
Okay. Wow.
Yeah.
Wow.
Yeah.
Wow.
So the idea that you were diagnosed 3 years ago, that really what we wanted to find it was 20 years before that.
Oh.
Mm.
Well,
Wow.
I was in a stressful job.
There you go.
Yeah.
Dr. Crawford, sorry I was late, but thanks so much to you and Greg for, filling me in on the first 15 minutes. I was diagnosed right at the same time COVID came in, and I was turning jaundiced, went to the ER, and actually my doctor, I had gone to my primary 2 days before going into the ER. She had ordered some blood work because I was complaining of just like you said, kind of generalized discomfort, abdominal GI issues.
Yeah, you wouldn't
But
even call
then,
it pain, especially, right? So something was wrong.
right, I knew something was wrong, but the last thing in the world, as I'm sitting there alone in ER, was pancreatic cancer. I mean, I think I was so in shock. That was kind of good because kind of came over me like a very calming, I was there alone. The nurses were talking to my family on the phone, thinking that I was kind of falling apart, and I was so calm. I think because I was in shock, and that was a blessing. But my point, though, is a lot of things, but a lot of things that you've said would just make sense and very important to me. But when I went for that blood work on a Saturday, having seen my primary on Friday, they were going to call me anyway because my liver enzymes are out of sight. And so Saturday night or Sunday night when I went into ER, it just took one CAT scan and they knew immediately that it was a tumor on my pancreas. And thank God they were reluctant to even stage it, of course, at that point or even later.
Sure.
But they staged it like around a 2. And of course, it was in a good spot where they could do a Whipple. So I was very lucky, and I just turned 78. I'm 3.5 years pancreatic cancer safe. And now my last point is when you mentioned stress, oh my goodness. I also was a nurse for 40 years, worked in the hospital. You talk about stress, but and regardless of that, yeah, I knew that stress was going to get me one day in some way, but I thought it might be a heart attack or a stroke. But it's interesting, your point about stress and the nervous system and pancreatic cancer, because people will say, well, I never drank, I never smoked,
Yep.
Like, and at this point, it doesn't matter. You've got it, right? But at a certain point, you look back and you want to help other people just with that early detection. And I know it's a cost thing. I realize that because doctors now, in general, and I don't blame them, I guess, when you go in with like a GI type of thing, my doctor 2 days before I was diagnosed thought, and I'm not, being critical of her. I'm just bringing out the point of the early detection.
Mhm.
She thought, oh, I had a hernia, maybe,
Mhm.
because of that feeling of the full feeling after eating, maybe very minimal. And then it had, those symptoms had to get a little worse though. I mean, I was afraid to eat anything then, because I was having issues. But I mean, if they could, I don't know, if people continue to complain, I mean, I was willing to pay for a CAT scan on my own time,
Sure.
if that's what it took. I have a friend, I was diagnosed now 3.5 years ago. She was diagnosed in the spring. She
Oh,
passed away about a month ago.
oh, so I'm
It
so
was
sorry.
stage 4 inner liver,
Mm.
and I just want to do more to help everybody. And I thank you. And thank Greg. He's been a big help to me
Sure.
too. And I know to our whole group, but thank you. I'm so glad to be here.
Well, I would say you're welcome, but I'm going to go with thank you for saying that. I mean, I think it's important that we're all working on this together, and I would argue that if we're not listening to the patients and what you're going through, like you just explained, then we're not doing our jobs, because that's how we're going to really find the insights that are going to lead to issues of early detection, or at least differential diagnosis. That I think what you described is, and I think the reason your doctor did what she did was that
Right.
the most, it's an odds game. The idea that your symptoms could be caused by 50 different things, and pancreatic cancer is the 50th most common cause of it, that
Right.
they of course don't think of it first, and that's a problem. We hope that once we get to there's some promise about blood tests, that not especially specific ones, but say a blood test that tells you that there's cancer somewhere in your body, there's something about your immune system that's a little off, that would say, okay, now we know we should be looking for some sort of cancer, with the other symptoms potentially narrows down to pancreatic cancer much more rapidly, versus saying, you have a hernia. So that would be not what you would see in these blood tests. So I think that has this combination of listening to patients, of finding more generically what's potentially wrong with them to eliminate maybe the more common causes, and then start to focus more specifically on where somebody might have cancer. And again, based on the symptoms, would have come to pancreatic cancer much more quickly than they would have otherwise.
Right. And one more thing, there was, I think it was Dex Crawford that did a study on the different chemotherapies used. And I think that your conclusion was, I know that profuranol is very important, but they were very reluctant to put me on that because of my age and everything.
Mhm.
And so I was just on the Gemzar and the Abraxane.
Mhm.
But the study that one of my daughters read, I think that you were working on, the conclusion was that Gemzar and Abraxane, in certain cases, for which I feel like I was one of them, it worked wonderfully.
And this was so you're really up on the literature, because this was coming out of a meeting, an oncology meeting in Europe last week, where they showed that, like a very well-controlled study with a lot of patients, that Gem-Abraxane combination was as effective, if not a little bit more effective, than FOLFIRINOX, which is exactly the opposite of what had been thought previously. And I have not dived into this data enough to understand why it changed. What was the difference in this study versus all the other studies? But it just goes to show that there's variables that we're not, taking into account for all of our patients. And I think that it might have been, in your case, lucky that they were hesitant to put you on FOLFIRINOX.
Right. God is good.
Yeah,
I have an oddball question.
I love those.
Jump
Do it.
to the 10,000 foot level and look down at this animal. When I was looking at your diagram and you were explaining how the cancer can communicate and latches on to the neurons, I thought, and it brought back in my mind, pancreatic cancer is a very, very intelligent creature, almost sentient if you if you didn't know better. But it's also an animal, and I described this in something I had written recently, that pancreatic cancer is like an alien in your body, hell-bent on committing suicide and taking you with it. How does that fit into the picture? And it's pretty accurate. How does that picture fit into evolution, where everything is driven by survival of the fittest, particularly with an entity that always ends up dead? How does it pass on the knowledge of all of these tricks that it uses in the body to grow and to stay alive and to spread?
So that's a huge question, Greg, and I'm probably not going to answer it in any kind of way that's meaningful to you, but I will try. So there's a couple of things that relate the pancreas to the nervous system. So we talk about how they're physically closely associated. That's one thing. But also, we know that some of the stem cells that are associated with pancreatic wound healing start to express factors that are usually found in the stem cells of the nervous system. So there's a developmental connection between the pancreas and the nervous system that probably is only revealed in the pancreas once there's damage, like chronic pancreatitis or cancer. And so it's pre-programmed to have a friend in the nervous system, because they come from some sort of common, I wouldn't say they come from a common progenitor, because I think that would go against actual developmental biology, but there's something about them that they have a relationship to each other. And then when they start to communicate, it's one of the most natural forms of communication that they have. Once they're damaged, or once they have tumor in them, they start to make the same molecules that you would find in the nervous system that the nerves use to communicate with each other. So what those connections are, I'm not entirely sure, but they're there. They're definitely there. So the other thing to bring up with the idea that the survival of the fittest, I always want to, every time I get new data, every time I read new papers, that the one thing that always becomes a central factor or a unifying factor in how I look at it is that pancreatic cancer is looked at by the rest of the body as a wound that needs to be healed. And it will employ all the different systems that would normally be deployed to heal the wound, but now that healing the wound is that the tumor says, "Oh, good, food," So they're everything that comes in that says, "I want to heal you up," it's resistant to, and that's not just resistant to; it benefits from those signals, and so it promotes it even further. So when it comes to natural selection and survival of the fittest, I don't really have a great answer for that. I do know that from some of my own work that there are cells that are forming inside the tumor that you would think, forms inside the tumor, it must be helping the tumor. It turns out if we get rid of those signals, it actually makes the tumor worse. So they're actually there. Those signals are there to heal the tumor. And when you eliminate them, the tumor becomes much worse. So there's some tit for tat still going on. There's a little bit of advantage that the tumor is taking from this wound healing response, but there's also some disadvantage. So it's all this. It's fighting with each other. They're one set of cells are trying to control the cancer, other set of cells are trying to feed the cancer, and the cancer is just like, you guys figure it out. I'll be here when you're done, and I'll continue to grow. So it's never that effective, but it probably makes it a little slower, if nothing else, that the wound healing response. So survival of the fittest, I don't know. That's a whole different question.
Right. Yeah, it's been rolling around in the back of my mind for a long time.
Well, you look at this. The idea, stem cells are there to heal, and cancer cells look like stem cells. So there's this going back in time to development that says that that it's trying to revert, it's trying to become something that's healing itself, but by virtue of that, it becomes something it grows faster. It acts more or less like it's like when your organs form, that they have a huge the huge growth of your organ as the cells are forming your organ, and it's like pulling them back through time and telling them to act like that again. and start growing again. But in this case, now it's an adult, and so that growth becomes a tumor.
Oh.
You know, we go philosophy for philosophy here. I don't know.
To go back to the stress issue, are there things that we can do? Everybody here's already had pancreatic cancer.
Mhm.
And we're all looking over our shoulder to try to see if we can reduce the chances of it recurring.
Sure.
And the last presentation with Ellie Martins, she talked about, the role that stress can play in the fear and anxiety of a recurrence as well. But I kind of think we should have flipped these two so we could focus more on strategies for reducing the stress.
Yeah.
And I know she had talked about the emotional kinds of aspects, doing things that you enjoy, having a tight-knit group of friends, social network and stuff like that. But are there other things that we can do? Maybe diet related.
Well, diet. I mean, you've also had a dietitian talk to you, as I recall. So I don't want to say anything to contradict, but if I had pancreatic cancer, I'd be like, don't tell me what to eat. I'm just going to eat what I like. If I can digest it, I'm going to eat it. Right. So
I'm with you, Howard.
yeah.
Answer, Howard. It's a good answer.
I appreciate it, but that's what I would do. I'm just telling you, if I study this all the time. So flipping it around, the idea that you did talk about stress last time, I didn't see that one, but there's a biological basis for why you should be relieving the stress, not just to make yourself comfortable, not just to, get through the day, but there's a biological reason you should eliminate stress from your life as much as you possibly can. I think that's the important thing. But I also think, yeah, if you try to fight cancer after you got it and by changing your behavior, I don't know that that's not going to cause you stress. I feel like it's like saying if it doesn't work, I'm failing, and that's going to cause you stress. I'd want you to say, I don't care. I'm going to just do what I want to do, and I bet you anything that's going to prolong your life compared to, don't start. I decided I've never smoked in my life, but I'm going to take up like a 12-pack a day habit. Don't do that, but you know what I mean, within reason, do what you enjoy, because I think that's the most likely way to alleviate your stress.
That's a good point.
Very true. Very true. Thank you.
Yeah.
Yes. Yes.
Yeah. I wish I had more biological basis and more data to show you for my opinion there. My opinion is what it is. But
sometimes your opinion is what matters most.
Okay, well,
we know you're good at the research part of it. We understand that, and we know how focused and dedicated you are. So
well, this is recorded. This is recorded, right, Greg? So I can play that last statement back to my wife, right?
Absolutely, because I understand being a wife. I understand the commitment you get.
Well, no, that you said my opinion counts for something. I think that's what I need to play back to her.
You have it on tape.
Greg might want that same segment.
Yeah, so I mean, like I said, I told Greg I really wanted to talk about this topic. I really would have loved to delve any deeper, but I was doing some work today to like how much more has been discovered in the past couple of years, and it really hasn't been a lot, but the data that's out there already is pretty strong. And so I think this is all kind of, so I know that some of the from interactions with my colleagues, that some of this idea that I presented it, that they've actually identified some of the molecules that are involved in the tumors and nerve interactions. I know that certain drugs are being repurposed that will block those interactions, and I know that they're in clinical trials, but I haven't heard anything about what the results might be. So there are opportunities to interrupt this communication, which, again, I don't think it'll be a panacea, but I think it'll potentially help. And like I said, the beta blocker thing, I don't know if you ever been on beta blockers. It's quite a nice feeling.
Yeah. Dr. Crawford, I'm Dr. Crawford.
Yes.
I'm glad that you said that again, because my short-term memory is not there. But when you mentioned, I came in when you were talking about the beta blockers,
Mhm.
and I've been on them forever. I mean,
Good.
20 plus years. But what was the connection again?
Let's when we get the actual, I'll look at my own slides to get the numbers again, but let's see. Let me find that. Okay, so patients that have been on beta blockers before their diagnosis and continuing on past their diagnosis have, let's see, lived approximately 2/3 longer than those who are not taking the medications. That is, we're talking about pancreatic cancer patients that have not been taking it, to pancreatic cancer patients that have been taking it throughout and before.
Right.
So
Right.
2/3 longer. Now, when we think about 2/3 longer, what does that really mean? So if the 5-year survival rate is 5 years, you're going to get another couple of years. My suspicion is that that's divided amongst a very large population where there's all kinds of other factors involved. So I don't know how big the population of patients they looked at in these studies were. So if it was large enough, then I suspect that that's 2/3 is the right number. But most of the time, that gives you a trend. Because the patient population wasn't very large, and finding patients that specifically are on beta blockers before and after was going to be a relatively small number. So I'm going to guess this is giving an indication without giving you a full spectrum. The idea that it's going to be beneficial, yes. Will it be 2/3? Will it be 20 times? I mean, who knows?
I'll take whatever I can get.
Well, it sounds like you've already done it. So
Yes, I have. And one more question. This might be again one of those off the wall things, but do you know if, or do you think that being on immunosuppressants for different things,
Mhm.
could that have any part in hastening maybe a growth of pancreatic cancer cells if they were there, and then you're taking maybe immunosuppressants for something else, whether it be arthritic conditions or anything? Do you think that has any part in hastening or getting a pancreatic cancer diagnosis, or any cancer diagnosis?
Well, this is not my expertise. I actually do work a lot in the immune system and pancreatic cancer, but I feel like, particularly since this is recorded, I'll say the wrong thing and people will come
Yeah.
at me.
No, we won't put
But
you on the spot.
well, that's fine. But my point is that immune suppression that's naturally occurring with pancreatic cancer is a major reason why pancreatic cancer is incurable itself. So the idea that you're on immune suppressants ahead of time, I could imagine would have a negative effect, particularly in the development, I would think, of various cancers. But yeah, I without the data in front of me, I don't want to make a commitment, but I understand your concern, and I think it's a legitimate concern.
Thank you.
Mhm.
All right. Any other questions?
Even if they're weird. I mean, Greg's already asked the weirdest questions. So you can ask any more.
No, Doctor Howard, he asked weird questions.
That's why he's doing this. Is good.
Yeah. Now I know I was fishing.
No, I
the question
completely understand.
on the stress ideas, but here's the reason why. I worked in the cognitive training field for a long time and 18 clinical trials, and I was having breakfast at Johns Hopkins with the top brain researchers in the world, and I noticed every one of them had a glass of grape juice, Concord grape juice, with their breakfast one morning. We all got together, and I pointed it out, and every one of them says, well, yeah, because it helps retain neurons. It's good for the brain, good for memory. And but there were two that didn't have the juice, and I asked them, well, why don't you drink the Concord grape juice? And they says, well, we prefer elderberry juice, and I had it at home before I came. They won't recommend it to anybody, but this is what they've learned from the research in their field, and each one of them was added this to their personal protocol.
Yeah, it's funny. I've seen people talk about their longevity research, right? And so the people that the experimental trials that are gone on longevity research is usually the researchers themselves. You know,
Right.
oh, we found this in an animal, and they make a concoction for themselves, and everybody in the lab drinks it every day. And you know, whether that pans out or not, it's another question. But the idea that they believe in it so strongly that they all take it, because of course they're also taking natural products most of the time, so there's not really any danger in that. But yeah, I've observed it myself firsthand. Yeah, I agree.
And the placebo effect is very real. So
You know what? Hey, if it works, it works.
if it works.
Well, sometimes what you believe is happening is as important as what isn't happening.
Let's turn this right back around. What is the placebo effect if it's not decreasing stress,
Right.
Mhm.
right?
Yeah.
Again, it's a belief that you're going to be okay. It's a belief that you have confidence that that's really what it's about.
Mhm.
Right.
Yeah.
Adage was the wisest one of all. Enjoy what you enjoy doing and do it.
Yep. I mean, what else are you going to do, right?
Right.
Just
Right.
Exactly. Look forward thinking.
I agree. If you people give up. I mean, let's face it. We all know people have given up for various reasons, various diseases. I mean,
Right.
throughout our families, etc. And you know, that's what did it. I mean, in the end, that's like when they give up, that's when it's over. And if they fight on, I mean, we like my mom when she was sick, she was fighting on until she knew we were all okay, right? And we were all okay. She died. So she just whatever kept her going was the thing that kept her alive.
Mhm.
That's
Mhm.
true.
Very,
That's true.
very true.
All right. If there are no other questions,
Hmm.
I would like to thank Dr. Howard Crawford for this presentation. Thank you. That was a critical
Yeah.
piece of information
Thank you.
right up front.
I'm
Dr.
glad to have
Crawford.
done it. I'm glad to have done it. I'm glad to see you all. You know, I'd actually like spending time with you. I should attend these more often without having to be the person on the spot, because I do like spending time with you.
Yeah, and you have to have a life too. And we are going to see you again. We know our paths are going to cross.
Yeah,
And we're very grateful that you're in the research field and you do all you do.
Yes.
I
For
appreciate
us
it.
and all the others.
Oh, and I would
We
like to
need
put
you.
in a plug for the open house on November 1st.
Mhm.
Down
Great.
at Henry Ford, Detroit. I think that's going to be a good event, and we'll probably see you there, I'm guessing.
You will, and don't pay any attention if my suit's too tight, because it's been a while since I've had that adjusted.
No worries. Okay, you look good. All
Well,
right.
I appreciate it. So you guys take care. I hope to see you again soon, and if I see you November 1st, even better.
That's
All
good.
right, very good.
Thanks, Dr.
Right.
Thank you, Dr. Crawford.
Bye.
Thank you.
Take care.
All right,
Thank
goodbye,
you.
everyone.
Bye,
Bye-bye.
everyone.
Goodbye, everyone. Bye-bye.
Bye.